In this video, we are talking about integrative sleep medicine. Struggling with sleepiness or unrefreshing sleep or insomnia can be super frustrating, but there are lots of things that can be done. If you want to learn how to improve your mental health, then go ahead and subscribe to this channel. I'm Dr. Bhopal. I'm a physician specializing in integrative psychiatry and sleep medicine, and this channel is all about holistic ways to improve your mental health. I'm the founder of Pacific Integrative Psychiatry, which is an online integrative mental health practice in California. And before we jump into the video, I would like to invite you to get our free holistic mini course that's all about natural ways to overcome anxiety and insomnia. So you can grab the mini course on our website, pacificintegrativepsych.com/mini course. The link is on the screen here and is in the video description below. This is episode 3 in our series on integrative psychiatry, and we are going to be talking about integrative sleep medicine today. Now, sleep is so fundamental to physical health, to mental health, to your performance, your cognitive performance, your physical performance. Like if you're exercising, it affects your ability to focus at work and to really, fulfill your full potential at work. It affects your relationships and your ability to communicate and your mood, just so many things. It's so fundamental. And, I'm a sleep doctor, I'm an integrative sleep doctor, and there aren't a lot of us out there, especially practicing integrative sleep medicine. So I thought this would be a good topic to share. So what's the difference between conventional sleep medicine and integrative sleep medicine? Well, conventional sleep medicine is really good at certain things. It's really good at diagnostics. It's really good at sleep studies. It's good at wearables and trackers. I actually have a wearable. I use an Oura ring, so it's great for that kind of thing. Conventional sleep medicine also focuses heavily on medical treatments for conditions like sleep apnea or narcolepsy or restless leg syndrome, parasomnias and movement disorders, and things like that. Conventional sleep medicine is also excellent for insomnia, especially the psychological aspects of insomnia. So the best treatment for insomnia for anyone who's struggling with that is cognitive behavioral therapy for insomnia, or CBTI. So conventional sleep medicine is really good at this. But what about integrative sleep medicine? How does that fit in? Well, integrative sleep medicine kind of jumps in where conventional medicine drops off, because conventional sleep medicine doesn't go into the other layers of sleep that affect our sleep quality, things like your gut health, your nutrition, any issues with toxins, any issues with micronutrient deficiencies. It doesn't really go in depth into supplements and genetics and kind of fine-tuning your biochemistry and your nervous system so that you can get better quality sleep. So integrative sleep medicine is really helpful for people where those conventional approaches that I just listed out, where they don't work. So if people are still struggling with excessive sleepiness or hypersomnia or other issues with their sleep like insomnia, and they've tried those other things and they haven't worked, an integrative sleep doctor can help you figure out if there's other strategies that would be better suited for your system. Integrative sleep medicine is great for helping people taper off medication. And so this is one thing that we really specialize in our practice at Pacific Integrative Psychiatry. We help people in weaning off those sleep aids that can be really damaging long term, especially those things like hypnotics like Ambien or benzodiazepines like Xanax or Klonopin. Those medications were never designed to be used on a long-term basis. So integrative sleep medicine approaches can help people get off those potentially dangerous medications. What I love about integrative sleep medicine is that it's so personalized. It's not a one-size-fits-all approach. We really figure out what's right for the individual person in front of us, because we're all so different. And so it'll bring in elements of mindfulness, of yoga, of using supplements appropriately, of looking at your biochemistry and your genetics and your nutrition and all of these other things, so that you can feel empowered or re-empowered to take your sleep and your health into your own hands and find lasting results. And research is actually supporting these approaches, and we're learning more and more about how yoga and mindfulness and all these other approaches are actually evidence-based and actually do have a lot of research and science supporting their use in helping people sleep better. So integrative sleep medicine and integrative psychiatry does not reject those conventional approaches. We actually embrace those approaches and we bring in all of these other elements. So you're really getting the best of both worlds. If this type of information is helpful for you, then go ahead and click the like button. So who is integrative sleep medicine for? Well, there's kind of two main categories. And we see this a lot in our practice at Pacific Integrative Psychiatry. So we get kind of the people who want to optimize their sleep. We work with a lot of executives and professionals, especially, from Silicon Valley, who really are interested in the tracking and optimizing their own sleep quality. So that's kind of one category of people that can benefit from this approach. The other category are people who are struggling with sleep disorders. So people who are struggling with insomnia or hypersomnia. For people who are struggling with sleep disorders, the approach is multifactorial. In some cases, people will keep working with their conventional sleep doctor in a sleep clinic and see an integrative specialist like myself or like we have in our practice to help them kind of wean off medication or just layer in other holistic strategies that can support them better. And what we see is when we start layering in those other approaches, people get better faster. They achieve longer lasting results. And it just enhances their overall treatment plan. For the first category of people who want to optimize their sleep, maybe they don't have a sleep disorder, but they just want to know how they can sleep better. Well, sleep is your secret weapon. Sleep really helps people stay on their A game. And so we work with a lot of people, like I said, from Silicon Valley, entrepreneurs, attorneys, executives, healthcare professionals, and getting really good sleep just helps to kind of fine-tune your performance. So we work with people to kind of see where there's opportunities for improvement, for enhancing their sleep quality, for even enhancing the underlying biochemistry that affects their sleep and their energy levels. And sometimes this approach involves working alongside the functional nutritionist in our practice for those nutritional plans and also for the gut health optimization piece. So if you're interested in working with an integrative sleep doctor, we see patients within California. We also have a network of integrative practitioners in the state and around the country as well. So you can feel free to reach out. You can drop a comment below. But we do see patients within California. We also do have an online program called the Holistic Sleep Reset. It's kind of a self-guided program for people who are out of state and can't work with us one-on-one. So you can see the video description for information on that as well. And check out our website, pacificintegrativepsych.com. Have you ever seen an integrative sleep doctor? Go ahead and let us know in the comments.